Hello everyone, my name is Dr. Whitney Hobson. I use she, her, hers pronouns, and I am a psychologist, and I work part-time at the Resource Group Counseling and Education Center, so I am an affiliate here with the Resource Group. And I'm really excited to be able to come to you today to talk about a topic that feels not only professionally relevant, but also personally and socially relevant as well, and that's the topic of racial trauma. So being able to spend some time today with you to give you just a little bit of a snapshot of ways that we can think about and define racial trauma, identify its impact, and also hopefully provide some suggestions for how to start the healing process. And so one of the things that feels really important today to start with are definitions, because I think we all can have an idea of what trauma is and how to conceptualize that, but what is racial trauma? So when we think about trauma and we speak about trauma, obviously we know that trauma is any deeply disturbing or distressing event, right? It's a psychological and emotional response to any deeply disturbing event or experience. And a lot of times we think about trauma as these one-off big ticket experiences, right? We think about a natural disaster, we think about a sudden loss or an unexpected violent occurrence. And that's obviously certainly one way that trauma can present, but trauma can also present in other ways. And specifically when we think about racial trauma, it is this traumatic experience that is really an accumulation of negative race-related experiences. And so there can certainly be one raging, singular traumatic event, but oftentimes when we're talking about racial trauma, it's these chronic, insidious experiences that happen across day-to-day life experiences, and it's the impact of the total of those experiences that can bring about trauma that presents in a racialized way. It's also important when we're thinking about racial trauma to think about the impact of systems and the impact of interpersonal experiences. So again, we can really identify these big ticket experiences of experiencing racism, but some of the more insidious things, if you kind of think about an iceberg where most of the mass is actually under the surface, a lot of times that's what's contributing to racial trauma. A lot of the things that it can be really hard for folks who are not a part of a marginalized community, a racially or culturally marginalized community to see, but that is experienced nonetheless. And just to be clear, when we're talking about racial trauma, this is connected to cultural trauma. And so we're really thinking about trauma as it relates to folks who've been oppressed and who've experienced marginalization at these large-scale systemic levels. One of the ways that these kind of chronic, daily, like insidious experiences happens are through microaggressions. And a lot of folks have heard about microaggressions, and I think sometimes because the term gets used so often, we're really not capturing the impact of it. But microaggressions are these daily environmental slights, insults, comments, invalidations, and really comments and actions that can bring about indignity for the person who's experiencing it. And a lot of psychologists and folks who do race-related work have deemed it death by 1,000 cuts, right? It's that kind of chronic, insidious thing. If you get one cut, right, it's gonna hurt, but it may not be as impactful as constantly being cut over and over and over again and having to heal from that experience. And microaggressions can be verbal or nonverbal. They can be intentional or unintentional. And I think that's really important for the folks who might be watching this who maybe aren't a part of a racially marginalized group, but want to learn, right? Like, how do I identify this? How do I contribute to the healing? Sometimes it's not always intentional, but it's important to start to check in with our own biases and our own belief systems to see how we might be engaging in microaggressing against other people. because even when they're unintentional, they can create a hostile and invalidating environment for folks. Like I already mentioned, discrimination and oppression are obviously a huge part of these conversations as well in terms of what can lead to the experiences of racial trauma. So unequal access and allocation to resources certainly limits folks' abilities to participate and to be present in success and achievement and relaxation and joy. We may not think about it on those scales, but when you think about what it feels like to purposely have things removed from your access because of part of your identity, something that you can't alter or change, nor would you want to. And you think about how that then shifts all of the responsibility and focus that you may have in your day. You have a lot less time for joy. You have a lot less time for relaxation. And so when we're thinking about things like discrimination and systemic oppression, these are really, really important pieces to note. These are also the ways in which that kind of chronic insidiousness can go unchecked and maybe cannot be easily seen. So for example, it could be something as slight but as impactful as if you're in Starbucks and you realize the way that the barista has talked to everybody before you, right? And maybe they're a part of majority culture, right? Like they appear to identify as white. And then you get up to the barista and all of a sudden they're very short and they're cutting you off and there's an edge to their tone. Something like that might be hard for other folks to see if this isn't their daily lived experience. But if that's happening every time you go to Starbucks and you go to this Starbucks 3 times a week, right, that's going to add up. Those experiences matter. Racial trauma is also connected to other forms of cultural and community-based trauma. And so a lot of times we think about trauma as being a singular and an individual experience. And obviously we can think of some large scale things that have happened in our society that have been more of a collective trauma. Racial trauma is also a form of collective trauma, and it's a form of cultural trauma. When you think about the fact that a lot of the ways in which discrimination and oppression exist cut off large-scale groups from access to wellness and access to resources. A lot of times we hear the term intergenerational trauma or transgenerational trauma, and it's really important to recognize that racial trauma has a place in that conversation as well. So when you think about, even the messages around things like professional hairstyles, and you think about what messages were given to generations before us, specifically I'm thinking about in Black and African American communities, about what is professionalism, and cut to now in 2021, literally having states having to pass laws to say that, it's okay to come to work with your hair growing out of your head the way that it grows out of your head, right? That's something that has been present across generations. And so it's really important to recognize that we're talking about how it affects us. We're talking about, for clinicians, how it affects the folks we work with, but we're really talking about how it affects our community. Because even for folks who may not identify as a part of a group or a culture that has been marginalized culturally or racially, we're all impacted by it. It impacts the messages that we receive about our neighbors, our friends, our peers, our colleagues, and then it impacts how we show up in spaces. It impacts our awareness of these experiences. And if we're not aware, in some ways we can't really do much to support one another. And so it's really important to have the language so that we can also show up for other people and be conscious, purposeful, present allies. Another thing that I just want to note, and this is kind of an aside, but I think it's important to say, is that so often when we're talking about the impact of racism and race-based trauma, we can be thinking about it in this way that's very binary, very black and white, and a lot of that's rooted in systems, and a lot of that's rooted in the history of the United States. But it's also important to recognize that racial trauma is pervasive through all folks who experience or who hold marginalized identities. And it might show up differently, it might look differently, but it's still just as impactful. So the erasure that Indigenous folks experience is impactful, right? Even the model minority myth that some Asian and Asian American and Indian American folks experience, right? Like there's a weight to that, and there's a historical precedence around why that was planted that is impactful. So even though some of the examples we have exist in the binary, I definitely want to note that we shouldn't be thinking about it just in the binary. We should be thinking about how this pervades across folks who identify as being in, you know, ethnic or cultural minorities within the United States. So how does it show up, right? So how does racial trauma actually show up? What are symptoms? What are experiences that people may have? So a big one is feeling isolated and feeling othered and really experiencing the pressure then to disprove stereotypes. And that can lead to a lot of internalized racism and a lot of internalized othering. There can be stress about feeling like you have to represent an entire group or community, right? So if somebody in your community does something, feeling like it is going to bear witness to every single thing and every single person within your community, and knowing and seeing that that's not how messages are given or how messages pervade when we're talking about folks who identify as white, right, or are non-people of color. Feeling fearful, feeling anxious, feeling frustrated, feeling helpless, feeling like there's not much control you have or much that you can do in the way of changing experiences and changing narratives, feeling depressed, feeling angry, and also it impacting your ability to focus, it impacting your concentration, feeling fatigue and energy and motivation. And that's a huge one, because then if you think of like the cycle that can be present if you're not as present, let's say at work, and you're feeling like it's taking you longer to do things, but one of the things that's contributing to that experience is racial trauma, well then you can feel like, oh my goodness, and I can't feel like this, like I have to be on top of things, I have to produce at a level that's just as good or not better than other folks, and then that causes for more stress, right? And then if you're also getting those outside messages to confirm those experiences, that's then going to lead to that chronic experience. A lot of folks also have physical representations of trauma, headaches, body aches, insomnia. Again, I don't think it's a coincidence that we see when folks come into therapy who identify as Black, Indigenous, or people of color, that folks will speak about a lot of somatic symptoms, so a lot of ways that trauma and stress is presenting in the body, because that's a part of this as well. Folks can also experience a lot of confusion, shame, guilt, self-blame, questioning yourself, wondering if it was something you did, really trying to piece apart what parts of this feel salient to your identity and what parts of this may be some X factor that you're not seeing, having to hold that and move through that. And then, also race-based health disparities. And so seeing a higher incidence, for example, of hypertension and heart disease and stroke and infant mortality, specifically in Black and African American communities. In fact, the study just came out, and I cannot recall who did it. So Google may be your best friend in this instance, but a study just came out that showed that infant mortality, which is higher for Black mothers than white mothers, something that actually ameliorates the difference in that is if Black and African American women, if they actually have a doctor of color, you actually start to see that higher rate of infant mortality decrease. And so, I think that that's one example of the ways in which race-based trauma is at play, even when we think about our physical and our medical health.